Hi, are you Keegan?
I am.
Hi, my name is Morgan. I'm a student nurse, and I was going to follow to you today. Can you give me a report here on Mr. Lutz, I believe his name is?
Yeah, I can. So Mr. Lutz is in room 621. He's a 67-year-old African-American male. He is a full code with no known allergies, and his doctor is Dr. Phillips. He has a history of diabetes and came to us because for the past 5 days he's had an increased blood glucose level of 300, and that's really concerning because his normal range is 120. He also has a non-healing wound on his right foot, and he's had that for 3 weeks. So we're going to be doing the dressing changes on that, but wound team is going to come around and make sure that everything is okay with it. His speech is clear, he's alert and oriented ×3, and he has no pain except for in his wound. His pupils are equal and reactive to light, and his vision is 20/20 with his glasses. He's experiencing some tingling in his lower extremities, so we want to watch out for that. So it could be some diabetic neuropathy. Due to the wound on his right heel, he is a fall risk, but his gait is steady other than that. His lungs are clear to auscultation, and he doesn't have any difficulty breathing, and his O2 levels are good with room air. His S1 and S2 are strong and present with no murmurs or gallops. His heart rate is regular, and so is his rhythm, and all of his pulses palpate bilaterally. Mr. Lutz is on an 1,800 calorie diabetic diet, but he's had some trouble following that. Recently, he has admitted to drinking a can of beer every Friday with bowling, and he also doesn't have a good exercise regimen. So to help with that, he's requested some nutrition education. His abdomen is flat and symmetrical and not tender, and his bowel sounds are present in all 4 quadrants. His skin is dry and intact except for his wound, and his wound is pink with no tunneling or undermining, and has moderate serosanguinous drainage. He's voiding fine. His last measurement was 320 milliliters, but we need to increase his fluid intake, so he has an IV site on his right arm.
Huh. Okay, well, what are you doing for him today?
Today, I'm going to give him his long-acting and his long-acting and his fast-acting insulin, because he gets his long-acting insulin twice a day, and he gets his fast-acting insulin before every meal. So we're going to do that.
Okay, what's insulin for?
Mr. Lutz has type 2 diabetes, so his body is not able to process the glucose in his body correctly into energy. So the insulin is going to help his cells able to accept the glucose and use it for energy for the body.
Well, how do you know how much he needs?
Well, his last blood glucose range was 242, and you always want to check that before you give insulin. And according to the sliding scale for regular insulin, he's going to get 16 units of insulin, and his NPH is always at 20 units per the doctor's order.
Is his glucose the only thing you look at when you decide you're going to give him his medication?
No, you also want to look at all of his vital signs. You also want to look at any of the other meds he's taking, because they could have some negative interactions with the insulin. It could cause him to have hypoglycemia or hyperglycemia. You want to ask him if he's taking any dietary supplements or any herbal medications, and if he has any allergies or kidney or liver failures or things like that.
What are, some side effects he's going to have?
The major side effects with insulin are going to be hypo and hyperglycemia. For hypoglycemia, you're going to be dizzy, drowsy, weak. You're going to have changes in your vision. So if that happens, you definitely want to let the nurse know or your healthcare provider. For hyperglycemia, you are going to have a fruit-like odor on your breath. You're going to have a faster breathing rate. You are also going to be flushed, and so that's not good either. You want to make sure that his blood glucose stays within 70 to 120, which is the normal range. And if it doesn't, you don't want to give the insulin if it's over that range or if it's under that range.
Okay, how do you know, that it worked when you give it?
Lab tests are really important for people who have diabetes. You want to look at their A1C level. His last A1C level was 5.2, which means that his blood glucose is being managed really well with his insulin. However, if you miss a lab appointment or something like that, it's very hard to tell if it's working correctly. And you also want to check things like their sodium levels, so their electrolyte panel is good too.
Okay, so we're ready, right?
Yeah,
Okay.
We're gonna, on my chart I have Greg Lutz, and he has no known allergies, and we're just gonna go make make sure that that is who is in the room. So, now wash my hands before entering the room. Knock, knock, knock. Hi, Mr. Lutz. My name is Keegan. I'm going to be your nurse today. And with me I have Morgan. She's a student nurse. Is it okay if she follows us around today?
Yeah, that's okay.
Okay, Mr. Lutz, I'm going to check your armband. Can you give me your full name and date of birth?
My name is
Greg Lutz.
My birthday is November 15th.
Okay, Mr. Lutz. Do you have any allergies?
No, I don't have any allergies.
No allergies. Okay, that's great. And are you in any pain right now?
No pain.
Okay, sounds good. Mr. Lutz, before I give you your insulin, I want to make sure that you understand why you're getting your insulin. Do you know why you're getting your insulin?
I think it's because I eat too much cake.
Well, personally, I don't think there's too much as such thing as too much cake, but that could probably be a reason why.
Yeah.
Your body is having a difficult time using the glucose that's already in your body. Your cells are not using it for energy like it needs to. So the insulin is going to be the key that's going to unlock your cell to help the glucose go into your cell and use it for energy. Okay, and today I'm giving you 2 types of insulins. Do you know how to give yourself these 2 types of insulins?
I usually just give them in my stomach.
Oh, okay. Well, yeah, you can definitely do that, but you need to make sure that you're rotating the sites that you're giving your injection. You can give it in your upper half of your stomach or your lower half. You need to make sure it's 2 inches away from your belly button, and you need to make sure that there's no bruising or rash around where you're going to give your site, or around where you're going to give your injection. You can also give your injection in your arm and in your thigh. Okay?
Okay.
All right. And do you know how to draw up the insulin that you're having today?
No, not really.
Okay, so when you have NPH, which is your long-lasting insulin, and your regular insulin, you will always want to start and end with the N. So you're going to start with your NPH, and you're going to inject 20 units of air into your NPH. Then you're going to go to your regular, and you're going to draw 16 units of air and inject it into your regular. Then you're going to flip your vial over with your regular. You're going to drop 16 units of your regular. Then you're going to go to your NPH, and you're going to drop 20 units of NPH. So for a total unit amount of 36. You want to make sure that your vials are not cracked. You want to make sure they're not expired. And you want to make sure that they're not too cloudy or clumpy or anything like that. You want to make sure you clean the vials before you insert your needle, and you want to make sure you clean the site where you're going to give your injection.
Okay, that sounds good.
So it sounds like we need a little bit of a nutritional education here. You need to make sure that you don't skip a meal, and you need to make sure that you don't overeat. These things are going to affect your blood glucose levels, and it could cause you to have hyper or hypoglycemia, and it's going to be really bad, okay? You want to watch your sodium level. You want to watch processed foods, no fruit cups, no canned vegetables, unfortunately, because those are the easiest to make right now. You also want to watch, maybe try and start having an exercise routine. You don't have one right now, and that's going to help you a lot to manage your diabetes.
Like maybe walking or something?
Yeah, walking is good. If
Okay.
you are going to exercise, you need to have a 10 to 15 gram snack beforehand, and if you're going to exercise for more than 30 minutes, you need to make sure that you have another 10 to 15 gram snacks on hand when you're exercising, okay?
Okay.
All right, well, I'm going to go get your insulin for you, and I will take you into the nurse. Okay, I'm going to wash my hands before leaving the room. Okay, so I have his MAR right here. I'm going to make sure it's the right time, and both the long-acting and the regular insulin are to be given right now. I'm going to make sure it's the right route. Both are given as injections. I'm going to make sure it's the right amount. 20 units of NPH and 16 units of the regular insulin. Okay, that's what it says right here. And then I'm going to make sure it's the right patient. I have good glutes, no allergies. Okay. And then I'm going to make sure my vials are okay here. With my NPH, I want to shake it. Not shake it, I want to roll it, I'm sorry. You want to roll it, make sure it's not too cloudy at the bottom. You want to make sure it's evenly dispersed. My vial is not expired. Okay. And my regular insulin's good. It's not clumpy. It's clear. It's not expired. No cracks or anything in it. Clean the top of my NPH. And then I clean the top of my regular insulin. So NPH is first. I'm going to draw up 20 units. 20 units of air. Make sure, Morgan, is that 20 units?
Mm-hmm.
Okay. And I'm going to inject 20 units of air into my NPH. 20 units of air into my NPH. Now I'm going to draw up 16 units. Regular? Morgan, 16 units.
Mm-hmm.
Okay.
Yes, ma'am.
Now I'm going to draw up 16 more units of make sure there's no bubbles. Then I'm going to draw up 20 units. 20 units of there's a big air bubble in that. Try that again. Okay. 36. And scoop method. Don't want to touch the bottom. Morgan, does that say 36?
Yeah.
Okay, awesome. Okay, Mr. Lutz, I am ready with your injection. I'm just going to make sure, I'm going to clean the injection site. I'm going to make sure one more time that I have the right patient. Okay, good. Okay, so we're going to do a pinch. Okay, sounds good. Put it into my Sharps container. Take off my gloves and wash my hands.
That didn't even hurt.
That's good. I'm glad. Okay, Mr. Lutz. I'm gonna give you your collate. Your bed's down. Do you need anything else before your meal comes? No? Okay. Alright, well, if you need anything else, please make sure to let me know. Let me know if the site has any itching, burningness, redness, anything, okay?
Okay.
So I'm gonna leave the room, wash my hands, and
So, like, the only thing you have to ask is if he has any food, and you just have to check his blood sugar, and that's pretty much it.
blood sugar, food, you want to check and make sure that he doesn't have any allergies. You want to make sure that his A1C levels are good. Well, that's after. But you also want to make sure you want to rotate his site. That's why I told him when he was only taking it in his abdomen that he can also do his injection in his shoulder and in his leg.
Okay.
Okay, so
So what are you documenting?
I am documenting right now that I just gave his injections and the teaching that I did in the site that I gave it in.
Okay.
So we gave. Oh no. Okay. I have to do it again. It didn't work.
Darn computers.
I know they're supposed to be smart and helpful, but sometimes it just seems like they're not. Okay, finally got it to work. Okay, so we gave it at 21. And we want to make sure we gave, regular we gave 60 units. 16 units in his right arm. Patient was 16 units, right arm, patient was compliant. Okay. Okay, so we gave that, then we have to do it one more time for the NPH. So we gave
Sure do.
Thank you, Laura. Okay, so now that we did all that, I'll go back later and document my teaching, but do you have any more questions for me?
No, I think that's it.
Okay, well, I'm just going to wash my hands one more time before I leave.
Thanks for letting me follow you.